In this podcast, we will speak about the age-related dermoscopic nevus patterns. Studies suggest that the number and dermoscopic patterns of nevi vary with age. In fact, nevus counts increase from puberty until midlife and thereafter decrease. The topic of this podcast will be delivered in 4 separate parts, which are related to the main periods of life. The 4 main periods of life are childhood, adolescence, adulthood, and late adulthood. It is advisable to listen to these 4 podcasts, beginning with part 1, followed by parts 2, 3 and 4. In part 2 of this podcast, we will discuss the dermoscopic nevus pattern of adolescence. Adolescence is the period between onset of puberty and adulthood. A certain proportion of nevi in adolescence exhibit a peripheral rim of small brown globules, like shown in this example. If followed up, these nevi will definitely change in the way that they show an symmetric enlargement. Therefore, the peripheral rim of small brown globules is nowadays a well-recognized sign of nevus growth. Yet we know that nevi grow until they reach stabilization, and the stabilization of nevus growth is related to the disappearance of the peripheral globules. In fact, if we follow up this growing nevus, at a certain point the globules will disappear, and at this stage the nevus will not longer enlarge or grow. So in other words, the time-related changes of involving nevi, they start at puberty, they are characterized by a peripheral rim of brown globules, they enlarge during adolescence until they reach stabilization, and which is characterized by the disappearance of the peripheral globules. So in summary, adolescence is the period of nevus evolution.